Welcome to the Fresh and Fired Up podcast. I'm your host, Dr. Emily Marshall, here with my amazing co-host, Haley Pindle, the one and only. We are here to help you feel and function at your best in health and fitness, in life, and we are ready to get fired up.
We're fired up. I'm so fired up for this one.
Yeah, okay, what are we talking about today? You want an intro? Periods.
I love it.
Yes.
Oh my gosh, this is my favorite topic ever.
I know. I'm excited for you and us and our
Yes.
listeners.
I'm excited for the listeners because I'm just going to babble and babble on.
Yes, because, okay, so you know what? I'm going to send this episode to my friend who I was talking to. So if you're listening to this, thank you for prompting us to do this episode because it's so, so important. Her daughter having difficulties with excessive and heavy bleeding. She's young. She's a teenager looking for solutions without, you know, of course, it's a sensitive topic for teenagers and it can feel embarrassing to try to seek help, even if it's from medical professionals, right?
Yeah.
So it's so amazing to see moms that are taking initiative to help their daughters through the process, especially if you're young and you're having like heavy excessive bleeding, cramping. I know young women who are throwing up from the severity of the headaches they have that come with their menstrual cycle. And so often it gets glossed over. We talked about this, Haley, before we hit record. It can be so almost like shameful to be like, oh yeah, you're just PMSing. It's like, no, but PMS is an actual thing. It stands for premenstrual syndrome, and it can involve a variety of symptoms. Do you want to share some of the symptoms that can come with PMS?
Yes, sure. So one that I definitely struggled with when I was growing up too was the headaches. Headaches were brutal. Migraines were just like I wasn't nauseous, but I definitely like could not think straight. Even like sleeping was hard for me because like my head was just pounding and like how do I sleep? And then other ones can be like cramping, it can be mood issues, like getting really irritable. I am definitely guilty of that. Um
Irritable, anxiety,
yeah.
sadness, depression.
Yeah. Depression is on a spectrum. There is PMDD, which is a little bit more of a severe form of getting really depressed the week before your period, which I think also is not talked about enough. But
Yes.
also, I think that like you are supposed to have a mild version of these symptoms. Like you can't get rid of them completely. It's just not in the books. So, but the severity can definitely be lessened. And I feel like people just normalize it. And then, which I don't get because like it's a whole week out of your month. So a whole week, how much, like what? That's such a long time to be feeling like crap, you
Yeah.
know?
And you can have like, no, I agree. Because you can have crying spells. Like I used to have way
Yeah.
more of those until I recognized what, and I still do, but I do it in a way that is like more productive
Mm.
in a certain sense. Like before knowing more about PMS and your luteal phase, like your follicular phase, your ovulation phase, then your luteal phase, then your menstrual phase, right? And like the ebbs and flows that your hormones go through with that. I used to catastrophize a lot more and grandize like my life is falling apart or like I'm so abnormal, like I'm crazy and stuff like that, right?
Yeah.
There's listeners that are like, well, there's probably some truth to that.
Sometimes I feel that way. It's so
Okay.
funny though, because like sometimes I will be irritable and say like I have a big workload and sometimes you can't control that. I'm in my luteal phase and I'm like, I swear, if someone says the wrong thing to me right now
In the wrong tone.
in the wrong tone, it's going to end very badly. And it's sometimes, it's really funny actually, because sometimes I will like lose it.
Oh yeah.
And I know I'm in this phase and like I know this is the reason, but it's like I wish other people knew that I was in this
Just
phase and at my
not.
short circuit was just like, oh, if you just do 1% over, it's game over, people. It's game over.
It is game over. Well, and I wanted to speak to what you said, Haley, about in more severe cases of symptoms, because we're looking at, I've read 75%, I've read 80%, anywhere from 50 to 80% of women ages 15 to 40 experience premenstrual syndrome. Just PMS. PMS.
Yeah.
That's easier to say. So it's a big percentage. And of that percentage, it's like 20 to 30% that it can be like severe, moderate to severe, in which case you're going to experience those depressive symptoms or irritation, like the mood side of it even more. Not only that, fatigue,
Mm,
lack of energy, it could actually lead to insomnia where you're not
mhm.
sleeping well, and then that exacerbates everything,
Yep.
let alone the physical symptoms, right? Like bloating, you could have breast tenderness. We already said headaches, back pain, muscle and joint pain, aches, weight gain. Doesn't this sound great? Constipation,
I know.
cravings,
I know. And like to some
difficulty
extent,
concentrating.
yeah. Yeah, to some extent, like it makes sense, right? Because your hormones are going to ebb and flow. And the thing about progesterone in the high hormone phase is, Emily, I have a question for you. It's going to be a little uncomfortable. Have you ever experienced period poops?
Yeah. Yeah. I'm assuming you have.
Oh yeah, and it's because our little buddy progesterone, like in the high
Buddy.
hormone phase, that's the thing that differentiates us from like men, which is progesterone in the high hormone phase. So it slows down digestion, and like you can feel constipated in your luteal phase, and then when the hormones drop in your period, then everything comes rushing out. Same with sleep.
That's been
Same with
hanging
sleep.
out there. It's coming out.
It's been hanging out there and now it's just gonna come for a party. There's blood, there's poo. It's a great time. Um,
Well, we're normalizing this for you, so you don't have to feel weird. This
exactly.
is your hormones and your physiology at work. It's so
Exactly.
beautiful.
And same with insomnia because our internal temperature increases. So your body has to hit a certain temperature to fall asleep. So it's a little bit harder in your luteal phase to sleep. And so just like make sure that your sleep environment, I'm pretty sure that we've talked about that on the podcast before,
Yeah,
is
we have.
optimized. Yeah.
Mhm.
Yeah. So it is normal to experience some of those things, but if it's like hindering your life to the extent where like you can't go to work, you can't go to school, like you can't do day-to-day tasks, then it's an issue.
Yeah.
Yeah.
Well, and it's interesting. I was thinking about this, and the reason I gave the stat of age 15 to 40 is because typically these are the symptoms you're dealing with. This is the stuff your body's going through. Women post 40 or at least post 45 start to think more about perimenopause, menopause, and kind of entering a different phase. And so we do have a podcast on that as well. It's a really good one, The Menopausal Revolution. It is with
Yeah.
Fiona Grove. So if you are thinking your mind is more on that phase, you can go back and reference that episode. But I think what also happens with women in their 40s is they have teenagers if you have kids. So now you're walking through your teenager through these symptoms and like stabilizing
Mhm.
mood and all of this, right? And it actually it irritates me. Okay, so disclaimer, I have a 12-year-old, so I am speaking with some lack of experience as she's not hit like full blown teenage years, right? But I think what can happen with parents is they start to complain about their teenagers, like they're so irritating, they're so annoying, they're so dramatic, or whatever it is. They fight me on everything. And so, one, their body's going through a lot of hormonal changes. So, give them that. Now, can we help them through the behaviors and how to cope? Yes. And I think it's very important to make sure that you are giving them the resources that they need. And
Mhm.
so I was just, my husband and I were talking about this morning because he asked what we were going to be talking about today. And just having the conversation of cognitive behavioral therapy and how effective that is for the mood related side of PMS. I mean, for anything mood related, emotionally related, what it does, it's like you said, Haley, it's not going to make all of your symptoms go away, but it's going to give you the coping strategies that you need. And it's effective within like 4 to 8 sessions. Like it's not even that many to give you the tools or give your teenager the tools they need to approach this topic in a healthier way. So I just
Yeah.
wanted to share
Yeah.
that.
No, I love that too. And like you just saying, give them the space to kind of like process, obviously give as much guidance as you can, but like going through your teenage years, like you're very emotional, and it's just like that's how your brain is developing, and it's not going to be fully developed until like you're older. So they're very
Ours still aren't
emotional.
fully developed.
Yeah, but like
Lord have mercy.
even thinking back to like my teenage years, like, and like my eating disorder, and like I was so emotional, and I don't see that right now because like I'm older. My brain is kind of developed, and like I can't see myself
Kind of.
acting so emotionally anymore because like it's funny, but there is some scientific facts to it, to like your brain is just very emotional, and it doesn't really know how to like process things, which,
Yeah.
you know,
Yeah. It's
it's a fun
development phase.
time. It's so fun.
They're challenging years, but I think that okay, so there's a couple things just to kind of bring us back to other possibilities. So like there's the PMS side of things where you're looking at your hormones and your physiology and the ebbs and flows. There is then cases where you can have extreme or excessive bleeding in the early years of getting your period. I think that this is such a key point that I don't think most people know this. There's something called anovulation,
Hmm.
and anovulation is in the first 1 to 2 years of getting your period, you aren't ovulating yet. And because you're not ovulating yet, you don't have that balance of progesterone to balance out what's going on in the other phases of your cycle. And you will end up with like super heavy bleeding, which is something similar that can happen once you get into the menopause phase. And what happens is because you're not ovulating yet, you get way more excessive bleeding. But then as your body starts to ovulate, it stabilizes. So if you see this in your teenager, before you rush out and get the conventional Western medicine advice of
Hmm.
birth
The pill,
control
yeah.
methods of any kind, really, uh, I know it can suck, but riding out the year or two could make a big difference. And then I was thinking about, okay, well, then how do we support their bodies naturally through this process? Well, here's the thing. If you are in a calorie deficit, it is going to take longer for your body to start to ovulate. So you need to be eating enough calories to promote your body hitting that ovulation phase. That is huge because two things are going to happen. You're either going to go to such an extreme calorie deficit like you had, Haley, where you lose your period altogether. And in the moment, you might be like, oh, this is great. I don't have to deal with my period.
Yeah,
No,
until it's
no, that
not.
comes with a whole host of other problems, right,
You
Haley?
don't want that to compound. No, no, no.
No. That is a much worse path, and you can share more about that like from your own experience in just a moment. But I feel like just the simplicity of how many teenage girls in particular are under eating without even realizing it because they're moody, because they wake up tired and they're like, oh, I don't feel like eating breakfast. I'm not hungry. Eggs look gross. Oh my goodness, that's true. I'm already starting to deal
No,
with that
I'm
with
just laughing at like the YouTube viewers are just gonna like that was golden. That was golden.
that is
Continue.
what happens. And you're going to be like, okay, we need to find a way to get calories in your body. And sometimes you're going to have to suck it on, princess, and eat something anyways, even if you don't feel like it.
Exactly, exactly. And you also see like the adverse where young girls are overweight and they're eating
Yes.
too much, and now their periods are coming with vengeance, and they're coming a lot earlier than they were a few decades ago. So there's
Yes,
like
that's a good
two.
point
Yeah.
because then they have a lot higher inflammation in the body. And
Yeah.
then you've got symptoms related to systemic inflammation.
Yeah,
So,
and
yeah, good point.
specifically like estrogen dominance, that's probably the thing that's happening too, because if you have a higher body fat percentage, a lot of the times women do, and this is in adulthood as well, women do struggle with like heavy periods, painful periods, and it's because like your body fat does have estrogen and produces estrogen in your body. So when you have the ratios of progesterone to estrogen off and estrogen is higher, then you do have the symptoms of pain, and inflammation, bloating, cramping, things like that, heavy periods as well. So those are like some really common signs. But yeah, there is definitely a lot of young women finding that their periods are coming out like 8 years old,
Yeah.
7 years old. Like it's crazy. Like, oh my gosh. How old were you when you got your cycle?
I was like 14 or 15. I was
Okay.
late because I had at the time I had hyperthyroidism. So I was like everything like functioning, all my body
Yeah.
functions really quick. And so same thing, I was really low weight, not intentionally,
Mhm.
but so I just wasn't getting my period. And at that time I ended up stopping. Like I didn't have any caffeine, like, cause I used to drink tea and stuff. So I really went after my dietary aspects. I also had prayer for me that I really think was very impactful in the process of my body healing and stabilizing and me mentally calming and all that. So yeah, there was a couple things that stabilized and I am getting my period. But I have a friend who I think she said she got it at like 7 or 8, like you said. And I was like,
Mhm.
whoa. Right.
Yeah.
So I started having these conversations with my girls already. I have an 8-year-old and a 12-year-old. And we started like age appropriate level of conversations about womanly things even at like 6 years old. And it's just like I steadily giving more tidbits of information when they come to you with questions, answering the questions, also preparing them. So for example, with my daughter, I feel like she's gonna listen to this when she's older and be like, oh gosh, mom, you're so
Mom,
embarrassing.
stop it.
But no, I think this is really important. And those of you obviously that have, everyone approaches these topics differently. I think it's just important that you are approaching the topics and communicating. So something I did with my daughter is we went online and we went to the Knix company, like the
Oh,
absorbent
yes.
period underwear. And it
Yep.
was so fun. We went through, we picked out the colors of the trainer set for youth. So it was like, this is, she got to pick blue or whatever she wanted and got her different colors and got options of shorts or underwear. We got them in, we opened them up together. They come with like a little pack that you can fold it up into. So she hasn't got hers yet, but she has that little pack in her bag. And then I also showed her, we went through together and I showed her and actually like went through the process of like putting on a pad, or this is what a tampon is, or these are the other options. So
Yeah.
she has all those little things in her little pack in her bag. So it doesn't just surprise her and feel like an embarrassment or shameful at school. She's like, I know
Yeah.
what to expect. The
Yeah.
other aspect is because it comes at different ages, I said to her, even if it's not you, hun, at least you know what's going on if your friends start talking about it. And what was I going to say? Oh, and then of course the unwritten woman code of like, and you're going to be ready if one of your friend gets it and they don't know what to do because their mom forgot to talk to them. You're going to be like, it's okay. I got you. I got my pack. You can borrow this. This is how it works. I'm like, this
Oh
is
my
so
God.
important that we are a community of women, even from a young age. I think like girls really need that mentorship from older women.
Oh, for sure, for sure. And like you have me thinking back to like when I first got like I was 11 and I just remember I got it at school and I had I was like
Oh,
I told my best friend I was like, "Hey, like I got my period." And
she's like,
no
oh
one knew.
no.
I was like, "I don't know." Like I just waited to get home because it wasn't like too heavy. I
Yeah.
was like, "I don't know what to do." Yeah, no, but it's very not talked about and I love that you are preparing your girls for it, not only for themselves but like for their friends
Yeah.
too, because it's like everyone, it's so strange because everyone gets it at a different time, no one really
Yeah.
knows what's going on, we're all like thrown into the deep end of the pool
Fire.
together.
Oh
And
my
it's like,
goodness.
what's going on?
This makes me think of a hilarious story. So when I first got my period, I think this is consistent for most women, but anyways, for me it was just pads at first, right?
Yeah.
And then I remember so I got invited with my aunt and uncle, and they had younger kids at the time. So I was like 14 or whatever, like around the start of when I got it. And I was on this trip to Florida with them to help like take care of the kids, and it was so awesome, right? And so I ended up getting my period, and we were going to spend a full day at a water park in Florida. And I'm like, yeah, I can't go, or don't worry, I'll just sit on the side. I'm all shy, and I'm all like, I just won't participate. My aunt's like, nah, I'm teaching you how to use a tampon.
Oh my gosh,
And
that's so valuable though, because you have no, oh my gosh, I have another story after you're
but I
done.
have this like image of my aunt who it's just, she's kind of hilarious, like dominant personality, like very direct. And she's got like a banana and she's like demonstrating, like she's
That's
the
hilarious.
whole thing. I look back and it's hilarious. And then I was like nervous, and she's like, no, you're going in the bathroom and you're not coming out until you figured it out, sort of thing. And I was like, okay.
As long as you figured it out good, because I did not have it figured out for like at least a year. So I was like you, like I only use pads because like tampons scared the shit out of me. It's like,
It's
no,
fair
I don't know
enough.
how this works. I'm not doing it. And so anyways, we have
Very
a place at a cabin and there's a lake. And so during the summer I had to figure it out for myself and I was too embarrassed to like ask anyone how to use this. And
Yeah.
I for years, I think it was at least a year, I was doing horizontal rather than vertical
Oh, so uncomfortable.
because I didn't know how to use it, and it was
Oh,
the worst thing ever. And then I finally figured it out and was like, okay,
this
this
feels
was good
better.
information. I find it's fine. It's fine.
Yeah, that's fine. Well, you know what's oh, side note though on this, if you are someone who uses tampons or like Diva cup or
Yeah,
whatever the cups, keep in mind, I think they're okay to use as needed in scenarios, but if you're experiencing back pain or pelvic floor
cramping.
issues or
Yeah.
cramping, that could be the cause if you're using them regularly. So
Yep.
free bleeding is actually way better for your body the more you're able to just do that. Now, I know some people instantly are going to be like, "Oh my goodness, it's way too heavy for that." So, situationally working with
Yeah.
your body, but just a side note that could help with those types of symptoms.
Yeah, for sure. No, I've seen that in myself as well. Honestly, I it's the period underwear that I can't do in the day, but at night it's
Yes.
great. The shorts,
The shorts at night are great.
life changing at night.
Yeah.
And I can actually sleep without like, when the pad's moving around and you're just thinking about
Oh,
it and you can't sleep, it's horrible. So get the period underwear. I don't have a link or discount code, but
yeah.
that's the way to
Yeah,
go.
it's super helpful. The
Yeah.
other thing, the other thing that I got, you can get blankets. If you're just like, I don't want, obviously you have a mattress cover and all that stuff, but you can get of all things, like there's like pet blankets that are completely
Like pee pads?
waterproof. Yeah, like seriously, that are like, well, there's the ones that they use in the hospital, like post
Oh
birth.
yeah, yeah,
But
yeah.
I'm saying like an actual blanket you would like let your old dog sleep on because the dog is now wetting itself. You know what I mean?
Yeah.
That are super absorbent and hardy, and you just throw them in the washer and dryer, and they're like super easy to use, just as
Yeah.
like another, and they're just a blanket.
Yeah.
But that's what they're designed for pets, but you could use it too. Anyway, so there's lots of hacks that can help. These are just our experience tips.
Yeah.
But I did want to get into a little bit more of the lifestyle,
Mhm.
natural ways that we can help with some of the issues around PMS or heavy bleeding.
Yeah.
Now, we didn't even bring up yet whether or not you're having symptoms of PCOS or endometriosis, which can both be pretty nasty. PCOS is polycystic ovarian disease. And what happens is this can cause irregular periods, and it's where you get an increase in androgen levels, and there's ovarian cysts that mess with your hormonal levels. So it causes this hormonal disorder that can be very, yeah, it just can really mess with your symptom, like all of those symptoms even more so.
Yeah.
And so same thing, like if you know that you have PCOS, obviously the uphill battle slope with these symptoms is going to be harder, but know that lifestyle based changes can still help a ton.
1000%. I've got
Yes.
multiple clients that have PCOS and their periods have been regular, not as heavy, less painful for sure. Another thing that I want to bring up too with PCOS is it can be very misdiagnosed these days. And like going through HA, and I find like HA is hypothalamic amenorrhea, which is what I had when you don't have a period because you're not eating enough. When you go to the doctor and just the fact that you don't have a period, doctors can be like, oh, you have PCOS, when the avenue of healing for both of those things are very, very different. So do make sure that if you think it's PCOS or HA, like typically if you're not eating enough and you're exercising a lot and you went on a diet, it's probably that you're not eating enough and your body has shut down that system. However, if you are maybe like you are eating, you haven't gone on a diet and you have maybe like some androgen hair growth, so like that would mean like maybe some hairs out of your chin or something like that. You have irregular periods. Oops. So like
Yeah, doctor.
it hasn't gone away completely, but they're irregular.
Mhm.
Then obviously you might be like, oh, it might be PCOS, but in those cases, like get your hormones tested, right? Because it is a very big thing to know
Mhm.
what your problem is so you can fix it correctly, right? Because like the avenue that I take with my HA clients is not cutting carbs, not focusing on that. However, with like PCOS, it might be better to do more of like a lower ish carb or complex carbs just because you do have that insulin resistance.
Yes.
So when you are, if you think you have PCOS, definitely like hound your doctor for more tests, because if you have HA2, like you can also have cysts on your ovaries. Like there's a lot of commonalities between the two. And I see it misdiagnosed quite a lot.
Okay, that is good because speaking of which, because we're so excited about this topic, it's easy to just get off on rabbit trails as we do, which is okay. I think it's been beneficial, but I realized I never even came back to you telling more about the symptomology with HA. Like,
Yeah.
right? Like some of the stuff that you went through with that. And so
Yeah.
you just kind of encapsulated a summary of each. But yeah, do you want to get into that a little bit more?
Of like HA.
Yeah.
Sure. So for my own personal story, like I did like get my cycle to 11, and then you go through puberty, and I think it's a really important thing, especially for parents, to recognize like your daughter is probably going to gain weight and don't say anything about it. It's just puberty. You become more insulin resistant, and then you gain weight, and that's just for hormonal. You're going to be reproductive and you need some healthy fat on you, and that's just a very normal thing. But
Mhm.
for myself, I saw that as like, oh, I'm getting fat, I should go on a diet. So I went on a diet and I lost my period for like 4 years, and it definitely hindered like my development to some extent. So I, yeah, but the symptoms of that were obviously like I was just consumed by food. I was dealing with obviously like an eating disorder as well
Mhm.
along with it, but my bones were brittle. I was getting a lot of injuries. My hair was falling out in clumps. Like I think I plugged my drains
Oh
every
my gosh.
day
Yeah.
with the amount of hair that was falling out.
Oh.
Yeah, my digestion was just really crappy. I couldn't poo. like,
Oh.
um,
'Cause
yeah, no,
everything
it was
slowed down.
everything slowed down, and it makes sense. Like my cognitive function slowed down, and like what happens when you aren't feeding your body enough energy and nutrients is it shuts down kind of processes that aren't necessary. So when your body is super stressed out and your environment is stressful, and like obviously over exercising and under eating is a physical stress on your body, it's like, no, I there is no way that you can have a kid right now, and the potential pregnancy is not a good idea right now. So it shuts down your system and your cycle. So that's what happened for the better part of like 4 years, and then had to put on some like healthy weight, like heal my obviously my relationship with food and exercise and things like that, and my period came back. um However, I did overshoot my weight a little bit, and then I felt like I was a bit overweight for my own body frame, and then I had very heavy periods at that point. So that would be like a little bit more estrogen than what is normal for my own personal body. And so in order to heal my hormones with that, um, anti-inflammatory was a very big thing for me. And if you do deal with cramping, I was never really a cramper. I never really dealt with that myself, but I know a lot of people do, and some of my friends do, some of my clients do. And for that, the reason that you do cramp a lot is because you have prostaglandins. They're like chemical, like hormone, like things that make your uterus contract, and they cause some inflammation. So in order to reduce the inflammation, like omega-3s are really good. um, Magnesium is really good. There's another little concoction if you take aspirin, like 80 milligrams of aspirin rather than the NSAID. So like the ibuprofen type, the Tylenol type. The aspirin does a lot better because it doesn't, the prostaglandins don't like come back. Whereas if you're taking NSAIDs, it's like it tackles it for that minute and then it'll come back later.
Yes.
So that's a little bit of a concoction if you do deal with some cramping. But overall, just changing your lifestyle, lowering stress levels, that is huge. Your gut
Mhm.
health is huge, mental health, and just like knowing where you're at in your cycle and just not overtraining, allowing for rest, especially as women. I feel like we can get into this like go, go, go and just really neglect our body when like your body never lies. If it's showing you that your period is getting longer and longer and longer or heavier and there's more cramp, there's more pain, like that's your body communicating with you that something's off. Okay. So listen to it.
Yes.
Yeah.
And educate your partner if you're in a relationship in a loving way, like maybe outside of your luteal phase when you're like irritable about it, like
Yeah.
when you're actually in your
Follicular
phase where
phase.
you're more energetic and calm, like in
Yeah.
your follicular phase,
Yeah.
having the conversations about the ebbs and flows is really important because men, like women, don't even know a lot about this topic, and men
Yeah.
definitely don't know.
Yeah, it was so funny. I have another story for you. Do you listen to Charlie Kirk? He's some
Oh,
anyways, it has nothing to do with politics. But
okay.
there's
Yeah.
this there was this girl I was watching on TikTok last night and she was hounding him about, oh, you don't know anything about the female cycle, and she was pronouncing like follicle luteal
Like,
phase,
just
and
pronouncing
she
it so
doesn't
weird.
even know anything about it, and I was like, "Oh my gosh, women, like,
This is
you should
horrible.
know your own body at least." Oh gosh.
Yes, yes,
It was
yes.
funny. It was really
That
funny.
is actually funny. So,
Yeah.
okay, so the other one that I wanted to bring up before we go to like, okay, so we definitely need to get to like more depth of the natural solutions that we can help guide you towards. But I did also want to bring up endometriosis. I wanted to make sure you guys like were aware of this one as well because it is something that can be very painful
Mhm.
and also missed, I believe.
Yeah.
So I just feel like realizing that with endometriosis, it is a medical condition where the tissue is similar to the lining of the inside of your uterus, which is called the endometrium, which is why it's called endometriosis. If you want to look more into it, you can, but it'll actually start growing outside your uterus. And so the tissues can be found in the ovaries, the fallopian tubes, the outer surface of your uterus, like along your pelvic floor, even. And so, if particularly in teenagers, if they're complaining of a lot of back pain with their period or pelvic pain, this could be something that is an issue for them. And what happens is it can even start, so the organs within it can even go beyond the organs within the pelvic cavity. It can cause hormonal changes as well. So you could have excessive bleeding with it. And with that sort of thing, it's like, okay, even as chiropractors, we'll have women come in and it's like, okay, they have back pain, they have pelvic pain. Lots of times, right? If it's mechanical or if it's neurological, chiropractic care is going to help a lot with that. Like that is the primary thing that we help with. And if it's not going away and it's particularly worse around your menstrual cycle, then red flags go up and you go, oh, okay, is this something else so that we can get you the proper testing to know, what's going on here? Because with that, you'll have very heavy menstrual bleeding as well. And you
Yes.
can even have painful bowel movements too with it because it's all pelvic floor stuff, right?
Yeah, exactly. And I think it has a lot to do too with like the prostaglandins again, like those are the things that are contracting. And if you have excess of them, they can kind of float around and go to other places like your GI tract, and then you have like gut
Mhm.
issues, and it's just again like inflammation. If
Yes.
there's a lot of inflammation, you'll have more pain. So like I did have a client as well who had endo, and we were able to minimize as much as we can like the pain through lifestyle factors.
Yes.
Obviously, like it is a condition that you're going to have to deal with, and a lot of the times women end up having hysterectomies
Yeah.
because it's just so painful. But just
Because it
lowering
can
the
be
inflammation of your
debilitating.
body and also like your environment, having it as low stress and just managing your stress, perceived stress and physical stress as well as possible can help to lower the pain and make it a little bit more manageable like every day.
Totally.
Yeah.
Yeah, and that kind of circles back to the mood and emotional, psychological state, cognitive behavioral therapy, seeing a
Mhm.
psychologist, huge for that. Don't feel ashamed about that. Like that is such a good thing to do.
Mhm.
I've done that. I've only had like random one-off sessions with a psychologist, even just dealing with as a healthcare provider, you're constantly dealing with people's high levels of stress and crazy scenarios like intense car accidents or intense, even like domestic dispute issues that caused an injury, that are like, you're hearing people's stories and they can be very sad and burdening, and you care for them and you love them, or you have patients you've cared for years and then they die tragically or whatever. So it doesn't matter if you're, even if you're a professional and you perceived environment, everyone's like, oh, you have it all together. There's no shame in getting like psychological tools to help you no matter what field you're in. I really think that, because I think there's way too much stigma around that.
Yeah, I
And so,
totally agree.
yeah.
Especially like if you're very empathetic too. And like typically people who are healthcare workers are empathetic people. It's why they get into the field.
Yeah.
And then like everyone's kind of dumping on you, and then you have to kind of keep your poise, keep your, your stress levels at bay. You can't like over accentuate it. And then you go home and you're like, wow, that was a lot. And you have no release yourself. So you have to find ways to release that. And obviously, like if you release a lot on your loved ones, like it's good to have a third party person, just because like your problems are also like your partner's problems to some extent, right? So burdening them with your stuff is then like kind of harming your relationship. So I think having an external person who has absolutely no relation to you and just is there to give you tools and listen to your issues is actually very helpful.
Totally. Yeah. So no, that would be more mental, emotional side of things. Dietary changes we already went through some of, and we do talk about this on other episodes, because it's anything that increases your inflammation. So anti-inflammatory foods, you brought up omega-3 fatty acids. I mean, there's so much more to this. We just talked a bunch about proteins, and like our 2 previous episodes, you need to go back and listen to, because those in and of themselves are going to help with inflammation. Some of the supplementation, but we do talk about dietary means first. Reducing caffeine and sugar are huge.
Yes.
And more so
fiber. I just wanted to mention that name. Fiber too is very, very good for, especially if you have heavy and painful periods, and estrogen dominance. Likely like you're lower on the fiber. So just make sure that you are getting like your veggies and stuff in.
And I want to make a comment on that. Know that fiber, there are 2 types. There is soluble and insoluble fibers. So anytime you are looking at if you have GI tract issues or difficulty digesting things, try to lean towards high nutrient foods that have more insoluble fiber. So if you look at like a cucumber, that's insoluble fiber, or like fleshy fruits, bananas, mangoes, berries, you're going to have more insoluble fiber in the inside of the berry. And then there's more soluble fiber on the inside of the berry, more insoluble on the outside of the berry. So when you grow up with like the era of like, well, you got to eat the apple peel because it's the best part for you. I'm like, well, it depends on how heavily sprayed it is.
Yeah.
But you don't have, sometimes if you're in a phase, your GI tract is really struggling, peeling the apple and eating the inside of the apple is actually probably going to be better for you, right?
Yeah.
So yeah, just kind of thoughts on fiber. Like it doesn't mean you need to go right to like eat my bran muffin, because it's high in phytic acid, which has a high binding capacity for all your micronutrients, right? So eating more fiber, but choosing your fiber wisely is huge.
Yes.
Which you can look into more, but also you can talk to us about more too if you need help with that.
We're here to help.
We're here to help. And then magnesium-rich foods are huge. And we talked about magnesium supplementation a bit last week. You got some magnesium-rich foods. Bananas. I just said bananas.
Honestly, I don't
We're
know.
practically monkeys over here. We love bananas. And then hydration.
Yeah, hydration we talked about too, electrolytes, and that becomes especially like in your luteal phase. Everything is luteal phase. I feel like follicular phase, everyone's got that down. Everyone's good there.
Yeah. And quite frankly, when I get low mood, and this might be happening for you as well, is when I get low mood, I don't want to eat. I drink less water because I don't feel like doing anything. Yeah. It's like now it's making it even worse. So even just setting yourself a timer or strategy is going to be like, did I have a glass of water? Let's go get another glass of water. Let's get some salt. Like, this supports your brain and your body. Exactly. The other thing is herbal remedies. So I know in the reel that I posted about this topic, which a lot of women chimed in, like, this is such an important topic, or even sharing stories about like, since age 15, I was on birth control for 8 years for this exact issue, for PCOS or heavy bleeding. And I did have a lady chime in, the Green Goddess. She's from our area. So if you are listening to this in your local, you'll know who she is, but she's all about the herbal remedies. And she posted like a type of tea mix that she has that can be really helpful. I'm not super versed in this area. Like, I feel like I know there's like, is it chase tree,
Oh,
ginger, turmeric?
chasteberry or something?
Yes. And then cinnamon, like there's different ones that can be helpful, but you can get that in teas too. So especially, I think that there's a comfort to drinking tea with honey in it that maybe if you don't feel like water, you're still getting hydration. And then you could be putting some of those good herbs in your body as well.
Yeah. I think
Um,
that's personal preference as well. Like I
yeah.
definitely like warm, hot. Same with my food in my luteal phase. And it helps me out too because again, like digestion is a little bit slow. So if you cook your food, it's gonna be easier to digest than if you're eating raw vegetables. But just
Mhm.
having that warm sensation is just nice and comforting.
Yeah, totally. And then obviously the exercise side of things, getting your body to a higher ratio of muscle mass compared to your body fat percentage, which doesn't mean you want to have no fat. It means that you want to have a healthy balance. And we were looking at healthy, what are the healthy percentages that we're looking at for females? It's, I believe, 22 to 28%.
Yeah, that's like the fitness kind of average. And then for like athletic, it's more 18 to 20-ish.
Okay.
Yeah.
Okay. So to me, I'm like, if you don't remember all the numbers, just remember like in the 20s, somewhere in the 20s, you should be good.
Mhm.
And that way you're not going towards no fat because that's leading down that eating disorder trail and
Yeah.
not good.
Yeah.
But having the exercise you need to support your skeletal system, your muscular system, and your nervous system is going to hugely help your symptoms that you're having around your menstrual cycle. Do not underestimate that because I feel
Yes.
like people almost write it off when you say it. It's like, no, this is the solution. And if you're thinking, okay, well, I have a daughter who's super active because she's, playing a bunch of sports. So maybe she is active, right? Now you're looking at, okay, if someone's already fit, now you're looking more dietary,
Yeah.
right? And you're kind of having this balance between the two.
Yeah.
And I know we're basically out of time. You got to go, I think, right?
Yes.
Yeah. So the only other thing I wanted to mention is physical therapies. Like you can do chiropractic can be helpful. Acupressure or acupuncture can be helpful
Mhm.
with symptoms. So any of the physical symptoms, the aches and pains, and even increasing inflammation, or right, if you are not exercising because your body's in pain or achy in some way, supporting your body through physical therapy, even just to get you feeling good enough to get you exercising, is going to lead you in the right direction. So
Yeah.
I think this has been great. I know we could go on and on about this topic, but we got to end for today. Shoot us any questions you have because we can do a follow up episode with more specifics. Share this episode with a friend. Make sure you rate, review, and subscribe. And in the meantime, be free, feel fresh, and live on fire.
Amazing.
Okay.